Thank you for coming, everyone. For those that don't know me, I'm Dr. Robert Selig, and my office is just right down the street. And today, I want to talk about natural health and how we can cure all these chronic diseases with natural medicine. And to me, the single most exciting thing in my mind is the body's ability to heal itself. That in itself is very exciting to me, and it's really one of the main passions that I have in life is healing. And so when we look at all the doctors of old, Paracelsus, Hippocrates, Samuel Hahnemann, Thomas Edison, the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. So the message is that we really can heal ourselves with the right natural therapies. And I want to introduce to you the chronic diseases that are plaguing our world and how we can heal them. So, the introduction to non-drug treatment of chronic pain and illness. My approach is to treat you metabolically, neurologically, structurally, and emotionally. And I base this off of the elements. So, fire is the metabolism, it's the fire, it's the combustion. The air element is neurology. Neurology is how communication happens, and neurology is how we communicate with our nervous system from brain to end organ. So communication happens in the air, and that's why neurology is based on the air element. Structure is the earth. Earth is our bones, and so how we reconnect to the earth element. And emotion represents the water element. And so this is what I based my practice off, the elements: fire, water, air, earth, metabolic, neurological, structural, and emotional. And when those four chime in together, that's the fifth element, that's the quintessence. So now, all chronic health conditions have a common thread. So whatever we're talking about, whatever chronic condition, whether it's thyroid condition, blood sugar, diabetes, cardiovascular disease, cancer, whatever the chronic condition, the migraines, the gut stuff, the irritable bowel, the Crohn's, the ulcerative colitis, all of them have a metabolic and a neurological component as well as a structure and emotional component as well. So I want to tie this all together to show to you how we can treat these diseases naturally. So obviously we know something is wrong in this country. We are in either number 1, number 2, or number 3 in cancer, heart disease, obesity, diabetes, all the chronic diseases, our mental illness. So we're in the top 1, 2, and 3 in all these chronic diseases. So we know obviously something is wrong, and that's where we got to change the paradigm. So the standard American diet, no coincidence, it's the S.A.D diet. It really is a pathetic diet, so we're going to start to understand the importance of food and the earth element. And some of the things that we're doing wrong, we don't have a good connection with food. We have to really understand how to get a better relationship with the food we eat and how food should be an exquisite experience to understand that we got to get off of all this junk food that we've grown up with, that we've been consuming, whether it's restaurants, whether it's just conventional food we've been buying. And there's going to have to be a change in that if we're going to get to the root of our chronic diseases. We also wait too long between meals to eat. You should never eat when you're starving. You should eat when you're hungry. We eat way too many carbohydrates, the sugars, too much processed foods, not enough whole foods. So our goal is to get more whole, raw foods into our diet. And a big one is we don't get enough quality fat. So I want to hit that point home, how we have to get good quality fats, because your brain and nervous system is fat. So we got to really have a better relationship with fat. We also eat for psychological reasons, which is also a huge component when we're looking at the totality of all our diseases and how we're eating psychologically, and the obesity and all the blood sugar issues as a result of that. Now, the father of modern medicine, Hippocrates, every doctor takes the Hippocratic Oath. And Hippocrates said, Look to the gut. There you will find the origin of almost all human illness. And it's not just Hippocrates, it's every doctor in the natural movement, from the Bernard Jensens to the Samuel Hahnemans to the Wilhelm Reich. All the medical doctors, all the eclectic doctors, all the herbalists, the homeopaths, the naturopaths, always said look to the gut. And so we're going to look to the gut tonight. Anything that causes an immune battle in your gut will trigger inflammation. Now you got to realize inflammation is the hallmark of every disease process in the body. So we have to address that. So the top metabolic disturbances that cause chronic pain and illness, it's poor gut function. What is that poor gut function? It could be infections, it could be food intolerance, the dysbiosis, meaning the good bacteria versus the bad bacteria, how the bad bacteria are winning the war, creating and wreaking havoc on our entire gut function. Also, other metabolic disturbances causing most of our pain is the blood sugar. We're going to talk about blood sugar tonight. We're going to talk about the adrenal dysfunction, the thyroid dysfunction, the anemias, chronic inflammation, and autoimmune conditions. So gut inflammation. We're going to look at this gut inflammation, and when we have gut inflammation, that sets off this cytokine bomb. Cytokines are the inflammagens, and they cross the blood-brain barrier. They react with the nerve cells, and when there's fire in the gut, there's fire in the brain. So my goal is to make this connection of the gut-brain connection and how important that is. Now, here's the take-home message. 70 to 80% of your immune system is in your gut. Just think about that for a minute, how huge that is. 70 to 80% of your immune system is in your gut. That's why all the pioneering doctors of old always said, look to the gut. Now, the brain in your gut. I want to point this out. This could be your esophagus, this could be a cut from your stomach, from your small intestine, your large intestine, but wherever they took this cut from, you have to see that this yellow tissue right here, this yellow tissue is neuronal tissue. When you look at all this nerve tissue, you have more nerve tissue in your gut than you do your spinal cord. That is, to me, amazing. So understanding that from mouth to anus, you are wired with neural tissue. We call that ectoderm from an embryological point of view. And so this nerve tissue is key to understanding how we're going to get healthy and understanding the neurological component to it, and how everything is going to be governed from the hypothalamus, pituitary, to whatever end organ, whether it's the adrenals, whether it's the ovaries, the testes, the pancreas. There is that gut-brain connection. And we call that a feedback loop. So everything is communicating with the end organ to the brain. Now, all this is mediated through the vagus nerve. So this enteric nervous system is mediated through this vagus nerve, which is the 10th cranial nerve. It's called the pneumogastric nerve. This pneumogastric nerve is one of the cranial nerves, and it innervates everything. It innervates your heart, your lungs, your stomach, your liver, your kidney. So basically this pneumogastric nerve, we call it the wanderer. It's the vagabond. So when we talk about the vagus nerve, it's a parasympathetic nerve. Now, I want to drive this point home, how we have in our autonomic nervous system, we have sympathetic and parasympathetic. Most people are on this sympathetic domination. We're never relaxing. We're always on the go, 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 doing, conquering the corporate world, never relaxing. And if we don't balance out the nervous system, that's our stress, that's our too busy to eat, too busy to rest and digest. So when you think of parasympathetic, think of rest and digest, feed and breed, and stay and play. Those are kinds of the themes of this parasympathetic nerve. So you need both nervous systems to be in balance, but in our culture, we're running on this sympathetic dominance, and that needs to be quenched if we're going to get relaxation into our gut, into our other organs. So a little anatomy. We're going to kind of look at how the vagus nerve innervates this whole gut-brain connection. So in our stomach, what's very important is learning how to really chew your food. We have to understand the ability to eat in silence, to really relax your nervous system so you can start to break down the food from the get-go. So it's important that we really take the time to eat in a very relaxed manner so we're not eating on the run. So when we break down the food with the gastric enzymes, with the hydrochloric acid, this makes the chyme. That's the liquid breakdown of the food. Now the vagus nerve, once this food passes this LES sphincter, the lower esophageal sphincter, soon as the chyme enters the duodenum, the first part of your small intestine, the vagus nerve picks up that signal. When the vagus nerve picks up the signal, it sends the signal to the epithelial cells in your mucosal lining of your small intestine. And in this mucosal line, part of the enteric nervous system that is mediated and regulated again by that vagus nerve. So this sends off a hormone called cholecystokinin, CCK. This hormone stimulates your pancreas to release pancreatic enzymes, the lipase, the amylase, the protease. This is the stuff where we're going to break down the food so we can assimilate it and take it in. And again, all mediated by the vagus nerve. Also, in the stomach has to be acidic. We have to understand the pH of our body. So in our stomach, we want a pH to be about 1.5 to 2, 2.5. Once you get in the 3, 3.5, 4, you're going to lose the effectiveness of your first line of defense is your stomach. And that hydrochloric acid has to be acidic. I got to drive that point home. But you'll see as we go from the stomach to small intestine, the pH now is going to get more alkaline because the pancreas, not only does it release its pancreatic enzymes, it also releases bicarbonate. So we start to become more alkaline as we enter into the small intestine. Then when it gets to the large intestine, we get a little bit more acidic. So the pH is huge in getting healthy and dealing with all these chronic issues, understanding where we need to be acidic, where we need to be alkaline, and that's huge. And again, all mediated via the vagus nerve. So here we come to all roads lead to the liver. So whenever we're dealing with any chronic issue, we always have to look at the liver. It's no coincidence that the liver is the largest internal organ and the liver is the general in Chinese medicine because it has so many functions. But we're just looking at one of the 1,000 functions of the liver, which is detoxification. So everything that we put into our body has to go through a breakdown, a catabolic breakdown, and the byproducts of metabolism, the byproducts of hormone breakdown, the estrogens, the cortisol, all of that has to be dealt with in the liver. So usually in phase 1 liver detoxification, it could take a lot. It will add some things to it to make it more water soluble so the kidneys can deal with it. The more fat soluble toxins, the bad estrogens, the xenoestrogens, the chemicals, the pesticides, the herbicides, all the toxins have to go through this process of methylation, sulfonation, glucuronidation, and glutathione conjugation. Those 4 things, big words, meaning we're adding sulfur groups, we're adding methyl groups to deal with the toxic estrogen, so then your liver can deal with it and dump it into the biliary system. Now, phase 1, phase 2 liver detoxification, we're dealing with all these chemicals, all these xenoestrogens, and now we can process it. Now, to get it out of the body, this is where we have to understand biliary patency. opening up the biliary ducts. When those ducts are clogged with all the junk you've been subjected to from day one of your life to all the stuff, whatever toxin we've been inundated with, that clogs the biliary system. We have to open up the biliary duct. So if you do phase 2 liver detoxification and you can't get the junk out, then it gets stuck. And so this is where we come in with coffee enemas. We come in with gallbladder flushes, the olive oils, and that's a key component of getting the junk out of your system. So the liver, all roads lead to the liver. So understand how important the liver is. In Chinese medicine, the liver is a hot organ. So when that liver fire starts to rise, we call it the neck pain, we call it the clenching of the jaw, we call it the migraines, we call it the hormone imbalance. So understanding that that liver likes to be cool even though it's a hot organ in general. So we have to know how to quench the fire of metabolism, which is inflammation. Symptoms of sympathetic dominance. So I briefly talked about the parasympathetic, sympathetic. When you're in sympathetic dominance, you're going to get the headaches, you're going to get the hormone imbalance, the high blood pressure, the poor digestion. You'll never be able to relax your stomach, your small intestine, your large intestine to deal with this, this war going on in our gut. So when you're in sympathetic dominance, you won't sleep. You don't heal unless you sleep. Also, there'll be cold hands, cold feet, chronic pain, dizziness, vertigo, all because we're in the sympathetic dominance. So, cytokines are inflammagens, and understanding, again, this gut-brain connection. And so, the inflammation in the gut, whether it's the heavy metals, whether it's the parasites, the liver flukes, the H. pylori, whatever we're talking about has a direct relationship to the brain. So I'm trying to drive this point home of the gut-brain connection. That is our intuitive center. That really is our second brain. So understanding the importance of the gut-brain connection is the take-home message. Cytokines are just this cascade of events of inflammation when we have poor digestion, when we have all these unwanted guests in us. So we have to really deal with this inflammation. That's why we got to look to the liver to clear it out. In functional medicine, the first thing we do whenever we're dealing with any chronic condition, whether it's a thyroid condition, whether it's adrenal, whether it's any hormonal thing going on, we first have to look to the gut. We have to deal with the infections. We got to remove the infections. We got to deal with the sensitive, how we're sensitive to certain foods, and those foods cause inflammation, the soy, the gluten, the wheat, etc. And we have to really restore the gut lining. That is key in getting healthy, and that takes time, but with the systematic approach, we can heal the gut lining. And so let's talk about the stomach acid. Hypochlorhydria, that's a lack of stomach acid, and this is a huge problem. Your parietal cells in your stomach produce hydrochloric acid. When that parasympathetic nerve is in sympathetic domination, you won't make hydrochloric acid. That hydrochloric acid is your first line of defense against any invading organism. Whether you eat a food that has E. coli, salmonella, your first line of defense is hydrochloric acid. That hydrochloric acid would render that infectious piece of food sterile. And so when you look at the carnivorous animals, the cats, the dogs, the wild tigers, they can eat some of the most horrific maggot-infested piece of beef and they don't get sick. How come the carnivorous animals don't get sick when they eat this god-awful infested food? Because they produce about 10 times more hydrochloric acid than we do. So they can get away with it. We have to be a little bit more careful of what we're putting into our guts, and we have to understand how important hydrochloric acid is. So not just the gastric enzymes, it's the hydrochloric acid. And this hydrochloric acid is huge. That's why I said your stomach has to be acidic. And we have to learn when you have low stomach acid, it's going to lead to the heartburn, the indigestion, the gas and bloating, the hair loss, the fingernails, depression, irritability, ulcers, food allergies. When people get gastric bypass surgery, what is one of the consequences of that surgery? It's cognitive decline, meaning that you become depressed because the hydrochloric acid in a gastric bypass surgery is destroying your hydrochloric acid. So most people who do that surgery, you always 5 years, 10 years later, they're in depression. And so it's because of the stomach acid. So we have to really drive this point home of how important HCl is in dealing with any chronic condition. Now, also the stomach acid, when we eat food, such as, let's say we eat proteins, those proteins have to be broken down to your amino acids. Those amino acids are the building block to your muscles, to your heart, to your liver, to your neurotransmitters, your GABA, your serotonin, your dopamine. So without stomach acid, you aren't breaking down those amino acids. You're not cleaving the amino acids to make, for example, L-tryptophan. You also need the other vitamins, the zinc, the B1, the B6, and the stomach acid to break down these proteins into amino acids. And then these amino acids, and you got, the 8 essential amino acids and 20 other amino acids, and they're going to make those neurotransmitters so that L-tryptophan will eventually become your serotonin. And so when you don't have that stomach acid, there's that depression with the serotonin. And this is just one pathway of many amino acid pathways. So how does this affect your overall health when you have low stomach acid? It's going to cause malabsorption of your nutrients, of the intrinsic factor, your B12. It's going to cause a lot of allergies and food sensitivities, the leaky gut syndromes, all the chronic inflammation because we're not breaking down the food, and that's huge. The irritable bowel syndromes, and again, gut-brain connection. Really want you to leave here knowing how important that gut-brain connection really is. So normal stomach acid, it kills the bacteria, the unwanted bacteria, the fungi. It helps with, it's the greatest protein absorption, the greatest vitamin and mineral absorption when you have normal stomach acid. So when you start to have a decrease in stomach acid, this is when all the opportunistic infections, the fungus, the candida start to flourish, causing the ulcers, the H. pylori and the ulcers. And you're going to get poor absorption of proteins, and that's going to impede everything, and especially the poor absorption of your vitamins and minerals. So that's how important stomach acid is, and we're on this pH thing. We think everything has to be alkaline. What we have to understand in the body, some parts of the body need to be alkaline, some parts of the body need to be very acidic. So I always say thank God for QRA, Quantum Reflex Analysis. That's Premier Research Labs. Dr. Robert Marshall has given us the best nutrients under the sun. And here's someone that I can trust. Being in the nutrition business for 20, 25 years, I've seen a lot of scandalous type of things. And knowing that I have Quantum Reflex Analysis, Premier Research Labs, he's given us the best products that really have left out the excipients, the toxic tagalongs, the magnesium stearates. You don't want that in your supplements. So if we're dealing with stomach acid, we want the best hydrochloric acid from betaine, from beets. And that needs a potassium activator to increase the stomach acid. We want good enzymes, so he's given us the best plant-based enzymes of the lipase, the protease, and the amylase. And probiotics are huge. Most people look at, you have 1 million count, 10 million count. It's not the quantity, it's the quality of the probiotic. He's given us the strongest probiotics that I've known in the probiotic world. So this is why I love when patients are coming to me for their chronic illnesses, they will be put on Premier Research Labs nutrition because it's the best in the world. Now we're going to talk about blood sugar. Blood sugar is huge. We have to really come to grips with our diabetes, our hyperglycemia, our hypoglycemia, our insulin resistance, because when we get into this insulin resistance, we call that metabolic syndrome, and eventually that's going to lead to the type 2 diabetes. Now, when you go to your medical doctor, you'll go first thing in the morning, they'll say, we're going to test your fasting blood glucose levels. So after sleeping for 8 hours, 2 hours later, waking up, getting to the doctor, 10 hours have passed, they check your blood sugar, and it better be under 100. Usually it'll be around 80, 85, and they'll say you're fine. Now, when you're walking around with your blood sugar 110, 120, 130, 40, 50, when you're chronically walking around with blood sugar elevated above 100, that's going to set off a whole cascade of events called inflammation. So, when we eat food, that's metabolism, that's the metabolic portion, proteins, fats, carbs. The goal of eating food is energy. What's the currency that drives the human machine? It's energy. We call it ATP, adenosine triphosphate. And that's why to make this energy, that glucose, when it's 80 to 100, normal glucose levels, it will efficiently get into the cell via insulin. Insulin attaches to the glucose molecule on the cell receptor to transport the glucose into the cell intelligently, and then through oxidative phosphorylation, the whole Krebs cycle, you're going to produce ATP that makes this machine work. So the pre-diabetic, what we call metabolic syndrome, is a fasting blood sugar between 100 and 126. So your goal is to always keep your blood sugar under 100. So when you eat a meal, after an hour, you test your blood sugar, one of those little blood prick things, and you check it. It's a glucometer thing. You can get them at Walmart, you know, cheap. And you test your blood sugar, and you never let your blood sugar, again, go over 100. Now, let's say you eat a meal, and it goes to 120, 130, okay. After an hour, if it doesn't drop under 100, we're calling that metabolic syndrome. We're calling that inflammation. We're calling that the precursor to every chronic disease under the sun. So we got to deal with this blood sugar if we're going to deal with all these chronic illnesses. This is huge. Type 2 diabetes, the statistics are, they're alarming. I mean, I think now half the world has diabetes. And we have to deal with this. Number one cause of blindness in the U.S., diabetes. 60 to 70% of diabetics have some form of peripheral neuropathies. That's the burning pains and the tingling in the toes or the hands. And also, it's kidney failure. So when you look at the blindness, the eyes, the kidneys, and the nerves and the toes, those are the three tissues where you don't need insulin to get the sugar into the cell. That's the one caveat about insulin. All other cells need insulin for that sugar to get in, not the eyes, not the nerves, and not the kidneys. That's why when you have elevated blood sugar and all that sugar is pouring into the eyes, into the nerves, into the kidneys, that's why it's destroying those organs rapidly. Really, we have to get this blood sugar under control, and I want to teach my patients how to monitor their own blood sugar so we keep that blood sugar in check. That alone is worth its weight in gold. Causes of insulin resistance, it's numerous. First, it's the diet. We always have to look at the diet. We're eating the wrong sugars, the wrong carbohydrates. We're not eating the good fats. The hormone imbalance, the cortisol, the bad estrogens are causing, there's that feedback loop that we call from the hypothalamus to the pituitary to the adrenals. And when your cortisol is elevated, your sugar will be elevated. Lack of exercise. When you work your muscles need that glucose, that needs the sugar. So exercise, we become so sedentary, and again, high stress, sympathetic dominance. When you're in high stress, you're in sympathetic dominance. That's going to cause the cortisol to to be elevated, and then when that cortisol is elevated, you're never in a relaxed mode. And so this is why we got to take time for sleep, got to take time for your yoga class, for your qigong class, for your art, for things that relax your nervous system. I can't emphasize that enough. So I'm always trying to tell people, do the things that make you happy, that relax your nervous system, and you got to understand how important the sleep is in the healing journey. So is this you? Chronic fatigue, constant hunger, inability to lose weight, craving sugar, fatigue after meals, wandering pains, we have hormone imbalance. That hormone imbalance can be, I can't lose the weight, it's the acne, it's the facial hairs, it's the estrogen dominance. And when you're in estrogen, the number one age-related liver toxin is bad estrogen. Bad estrogen, it's the xenoestrogens, the phytoestrogens, the normal age-related estrogen is causing that to be the number one liver toxic substance in our bodies, is this bad estrogen. This bad estrogen is going to, when you're in estrogen dominance, your cortisol will be elevated, but it will crash your vitamin D, it will crash your testosterone, it will destroy your progesterone, it will destroy your thyroid hormone. So this is why we got to understand how to get balance in our body. And also this estrogen dominance will increase the cholesterol, the triglycerides, because it's causing inflammation. And we're going to talk about cholesterol in a minute. So all this causes chronically high levels of glucose and insulin, and your cells stop listening to insulin, and you become insulin resistant. That is huge. So what is the medical solution? More insulin. Okay, insulin, why use it? Why bombard your cells with insulin when your cells don't even recognize it anymore? So we have to change this paradigm and not to, go on all the insulin medicines. We have to get a little bit more wise and hip to solutions to dealing with this insulin resistance. So again, insulin is going to increase estrogen in men, it's going to increase testosterone in women, it's going to increase all the cytokines, the inflammation, it's going to screw up the liver detoxification pathways, it's going to increase the blood pressure, the cholesterol, and it's going to play with your neurotransmitters. So you eat food, you make insulin, your cells start to resist the insulin. That insulin is stored as fat, the sugar stored as fat, and then you always feel tired and hungry. This is the vicious cycle. And so here's the obesity estrogen cycle, and gentlemen, this applies to you too. So you're thinking, what does estrogen have to do with me? That estrogen dominance is your shrinking testicles. That estrogen is your loss of libido. That estrogen is your man boobs growing, your belly fat growing. You have to deal with this estrogen. So when we have increased obesity, that causes this enzyme aromatase. This aromatase converts testosterone into estradiol. That increased estrogen does what? Decreases muscle mass and increases fat. So understanding this obesity estrogen cycle is huge if we want to deal with this weight problem we have in this country. High insulin, inflammation through the body, cardiovascular consequences, low testosterone in males, high testosterone in females. What else controls your blood sugar? We know the pancreas is where the islets of Langerhans and the beta cells make your insulin. The adrenal glands are huge with insulin. Thyroid hormone and insulin are inversely related, and the liver is where we have our glycogen storage. And when that liver has too much fire, too much stasis, too much congestion, you're not going to deal with this this blood glucose glycogen stores intelligently. And this is why I keep always saying all roads lead to the liver. Now we're going to talk about the adrenals. Now, what are the adrenals? Right back here, right on top of your kidneys, you have a little, about an almond-shaped gland that produces about 50 or so hormones, one of them being cortisol, epinephrine, norepinephrine. The adrenals in Chinese medicine is called the Jing. The Jing is one of the treasures. You have the three treasures, Qi, Jing, and Shen. Your adrenals are your Jing. That's the battery. When that battery runs out, you're dead. And so when we start really dipping into the adrenals because we're under stress, we're in inflammation, we're in sympathetic dominance, we burn out the Jing. And when we do that, we're going to go into the reserves, and that's going to go into the bones. And when we go into the bones, that's when we start to run into a lot of trouble. So causes of adrenal dysfunction: poor diet, anemia, hidden food sensitivities, again, gut infections. We always got to look at the gut and the gut infections, the chemical stressors, the prescription drugs, the Advils, the Tylenols. Tylenol actually is one of the most liver toxic drugs on planet Earth currently today. The sympathetic dominance, our emotional stresses, not sleeping when we're in sympathetic dominance, which causes our brain imbalances and all of our neurotransmitters because of the hypothalamus pituitary adrenal connection. That's what we call the HPA axis. That is huge. Effects of adrenal dysfunction: the high cortisol causes insulin resistance, causes weight gain, disrupts thyroid function, is toxic to the brain, insomnia, mineral imbalances, and chronic pain. This is why we got to deal with this adrenal dysfunction intelligently. Now let's talk about cholesterol, because we have a war on cholesterol. I remember, 20 years ago talking about we got to get this cholesterol lowered, we got to start giving statin drugs. We're even going to start putting statin drugs in the water. And we really have a warped sense of what cholesterol is. And here's your body making cholesterol. This cholesterol is a backbone to pregnenolone. Pregnenolone is a precursor to all your steroid hormones, including your progesterone, including your estrogen, your cortisol, your testosterone, your DHEA, all have a pregnenolone cholesterol backbone. So cholesterol makes your pregnenolone. Now, when you're in sympathetic domination, you're going to be producing cortisol, cortisol, cortisol. So the pregnenolone, instead of making the progesterone, instead of making the testosterone and the DHA, your energy is being diverted to just making the cortisol, and then you wonder why you have hormone imbalance. You wonder why that you can't get your testosterone up, you can't balance out your estrogen, or why our thyroids are tanking, why our vitamin Ds. Everyone I test in my office has low levels of vitamin D. And again, it's understanding the liver, it's understanding the cholesterol. 80% of that cholesterol is synthesized where? In your liver. Again, all roads lead to the liver. Liver congestion, liver fire, liver heat rising. You're not going to produce the cholesterol sufficiently. And then when it does get produced sufficiently in excess or too much or too little, and again, when you're in stress, when you're in that cortisol sympathetic domination, you're going to put all the energy to this pathway, and you're not going to make your progesterone, you're not going to make your other hormones. So I wanted to drive that point home to show cholesterol is not the enemy. Cholesterol is actually every cell in your body, every trillion cell has, on the outer cell membrane, is a cholesterol backbone. So why would you want to take a drug to suppress cholesterol? That has to be the most idiotic thing in medicine today, or it's in their top 10. So in functional medicine, what I practice is functional medicine, and to treat the adrenals, we have to remove the stressors. We have to get parasympathetic balance. I'm going to keep saying that ad nauseum. And I'm going to support you with homeopathic remedies. We're going to practice pH medicine. We got to fix digestion. And when I fix digestion, when we're talking about the adrenals, one of my favorite remedies is Pancreaven. That is a phenomenal pancreas blood glucose natural remedy. It's a plant-based herbs and vitamins and minerals in a nice synergistic formula. We're also going to use other vitamins and minerals, the magnesiums. We got to deal with this dental issue because of the heavy metals and boy, if our bite is off, if we're not chewing our food. So we really have to look and address the dental issues. And again, exercise. And we have to understand when we're dealing with the adrenal disorders, we have to understand detoxification, we have to get biliary patency, we have to flush the kidneys out, we have to sweat the skin, we have to do a lot of things to get the channels of detoxification, the lymphatic channels open. So I usually like to educate my patients on how to focus on detoxification. And if you're not getting at least 6 hours of uninterrupted sleep, you'll never heal your adrenals. All the herbs, all the vitamins, all of the things that I give you are great, but if you don't sleep, it's all a waste. The first thing you got to do is you got to get in that parasympathetic mode of relaxing and really focusing on getting at least 6 hours uninterrupted sleep. What's the #1 problem in our country? I'm tired. We go to bed tired, we wake up tired, we're chronically tired because sympathetic domination, not sleeping, and every other thing that we're doing wrong. So again, sleep is huge. Now we're going to talk a little bit about the thyroid. And you know, when you have symptoms of fatigue, when you have weight gain, when you have loss of hair, when you have poor digestion, constipation, itchy, dry skin, the brittle hair, the chronic digestive problems, that's the low stomach acid, the edema, all this stuff, you have to start thinking about the thyroid. And again, is it the thyroid? Is it the adrenals? Is it the sympathetic domination? This is why you can't look at one organ system in isolation. You got to look at the whole picture because it's all connected. If you have a thyroid problem, more likely you also have an adrenal problem. You also have a nervous system problem. So this is why when we're dealing with any chronic area of the body, whether it's thyroid, adrenals, estrogen, we have to tie it all together. Causes of thyroid dysfunction. 90% of all hypothyroid conditions is autoimmune, meaning your own immune system is eating itself, is attacking itself. So another cause is, again, the high cortisol, the bad estrogens, from birth control pills, hormone replacement therapy, a congested liver, poor gut function, and a sluggish pituitary gland. The gut-brain connection again. So the thyroid supports everything. It's the metabolism of your cells, whether it's bone metabolism, immune, brain, nervous, endocrine, gastrointestinal, liver, gallbladder, growth and sex hormones, fat burning, insulin and glucose metabolism. You have thyroxine, which is the hormone of the thyroid, which is in every cell in your body. Now, here's this hypothalamus. The hypothalamus sends a signal to the pituitary, and then the pituitary is going to send its signal to any of these end organs, whether it's the testes, the ovaries, the adrenals, the thyroid. And again, as we're talking about the thyroid, your thyroid makes T3 and T4. T4, 90-something% of that T4 is inactive, and that's made here in your thyroid. The T3 is the active form of the thyroid hormone, but you only have 7% of that T3 in your thyroid. So that T3 catches a cab to the liver, and in the liver you're going to convert T4 into T3. And if you have a sluggish liver, guess what you're not doing? You're not going to convert the T4 to the T3. So again, why do I always come back to the liver? Because the liver is where we live. When we live healthy and we understand how to maintain our health and how to build our health, then we start to get the liver to function a lot better. So there's 6 major thyroid patterns. When we have primary hypothyroidism, this is where I concede to Western medicine and you will have to be on some form of medication. But that's a small percent. The 90-something% of our thyroid conditions are hypothyroidism, are thyroid underconversion, T4 to T3, our overconversion, thyroid binding globulin. So and then we have thyroid resistance. So these are some of the major thyroid patterns, but what I mostly see is the hypothyroidism due to, again, sluggish liver, gut infections, autoimmune stuff. So when I assess my patients, I have to run some lab tests. I have to know where your cortisol levels are. I have to know where your thyroid hormones are at. I have to know where your estrogen, progesterone, testosterone, your DHE, you know, where all your markers of hormones are at. We also will run I usually use ZRT labs and diagnostic text lab. The diagnostic tech labs is going to tell me about the gut infections. Do you have parasites? Do you have H. pylori? Do you have liver flukes? And if you do, that has to be addressed. That's why the first place we start is the gut. We also will test, do you have gluten sensitivity, soy sensitivity, egg sensitivity? So that's why proper testing is critical. So in functional medicine, we're going to look at the lab findings, then we're going to assess you, and we're going to apply the right nutrition for you. And when I apply nutrition to you, we're going to test you. We're going to muscle test you to see, does your body really need this? So it's not me saying you need this product. I'm going to let your body tell me what it needs. So that's why we do quantum reflex analysis. We always have to deal with the gut. We got to deal with the thyroid and adrenals. We got to deal with the liver, and we got to create biliary patency. And this is key, and that's where the detox comes, and the anemia, the sugar regulation, and dealing with any autoimmune thing. And I will probably put most of my patients on an autoimmune diet, which is an anti-inflammatory diet. We're going to take out the dairy, we're going to take out the soy, we're going to take out the wheat and the glutens, and we're going to emphasize the good fats. So anemia, there's another huge one. If you have a chronic condition and you're walking around with anemia, and women are very familiar with anemia when, you know, every cycle you're bleeding too much, you're losing your blood. And again, there's that hormone part to it. There's the sympathetic nervous system part to it. So we have to address the anemia. The anemia is how our cells, our red blood cells, take in oxygen. And we need oxygen, and the hemoglobin, the oxygen's going to combine to the hemoglobin, and that's going to deliver the oxygen. If you don't have oxygen circulating through your body, you will have every disease under the sun. And this is why we have to address the anemias. So again, it's blood loss, it's menstruation. A lot of people that have hemorrhoids, they're losing blood. Ulcers, we're losing, you know, you're bleeding. We have to, when you have anemia, when you have pernicious anemia, that's where your stomach acid and your intrinsic factor are not making your vitamin B12 due to, again, maybe it's the gut functions, maybe it's the low hydrochloric acid. So we got to look at all the causes of anemia if we're going to address anemia. So the effects of anemia is going to be our headaches, our dizziness, our lightheadedness, our brain fog, our insomnias, chronic fatigue, numbness, tingling. These are all signs and symptoms of anemia. In the treatment of anemia, we have to treat you with vitamins, with minerals. We have to fix the gut. We have to modulate your immune system. And we got to, again, detoxification. You'll always see I'm coming back to detoxification, so we have to really focus on how important it is to detoxify the body. We have mud, we have, you know, putting the mud baths on us, putting the mud on us, doing foot soaks. You know, when you eat 3 cloves of garlic at night, what's going to stink first thing in the morning? Your feet. So we have to understand the foot soaks with the mud to remove all the toxins. We have to understand how to use infrared saunas to sweat out the toxins. So when you start sweating out the toxins through the largest organ, your skin, then you're going to spare the liver, spare the kidneys, spare the lymphatic system, because we're trying to get a lot of the toxins out through the skin through sweating. So again, always detoxification. Now there's some anemias that, again, I will concede to medical intervention when it becomes a life-threatening situation. So again, putting it all together, we have to understand the brain component, the blood sugar component, the hormones, the oxygen deficit, the cortisol, because somehow all of this has to come together if we're going to deal with any of our chronic diseases. So whenever we have metabolic disorders causing brain imbalances, so all of our anemias, all of our thyroid conditions, our adrenal conditions, all of this eventually is going to lead to what we call the brain diseases, the senilities, the Parkinson's, the dementias, the MS. So all of these things eventually, all of a sudden, grandma has Parkinson's or grandma has Alzheimer's. You just don't wake up and have Alzheimer's. It's an ongoing thing that we ignored through the many years because we didn't deal with the anemia. We didn't deal with the blood sugar. We didn't deal with the food sensitivities. We never restored balance to our immune system. So again, if we want to understand brain health, we have to really put all the pieces of the pie together. So again, proper testing is critical. I have to see, do you have gut infections? How are your hormones really working? Where is your cortisol levels? When you go to the doctor and the medical doctor, they'll take one sample of your cortisol. Cortisol is diurnal, meaning it's very cyclic. When you wake up in the morning, cortisol should be high. When you go to bed, cortisol should be low. So we want to take about 4 to 5 samples of cortisol to get the bigger picture of how your cortisol is functioning. So that's kind of here's my sales pitch. I usually only accept 5 chronic pain cases per month because it's a lot of work dealing with a chronic pain case because you got to interpret the labs, you got to set up protocols, you got to deal with the nutrition, you got to understand how important structure, from a chiropractic point of view, when your head starts to go forward on your spine, that parasympathetic nerve will get encroached upon and you'll be in sympathetic dominance. So we got to understand how structure determines function. We got to get flexibility in the spine. We got to deal with all the curves and the kyphoses, the disbalances in our sacrum. So we really have to address you structurally. So again, here's my offer. Usually the first 2 visits is $450. After watching this presentation or watching this on YouTube or whatever, I'm only going to charge $175 for the first 2 visits. And then I will set up a care plan that will help get you on the road to optimal health. And here's the other half of the ticket. You have to want to get healthier more than I want you to get healthier. You got to do the homework. If you're not willing to do the gallbladder flushes, the coffee enemas, the dry skin brushing, the infrared saunas, if you're not willing to deal with the toxic emotions that are putting you in sympathetic domination, if you're not willing to make sleep a priority, if you're not willing, I'm too busy to eat right, I'm too busy to go to my yoga class, then you become the monkey in the cage, the rat in the rat race, and we're always giving a million excuses why we don't want to get healthy. Health is the most important thing. Health is wealth. And understanding that is so important on the healing journey. So it's more than just coming in to see me. It's you have to want to get healthy. I'm here to teach you, to educate you, but who heals you? That's between you and God. I teach you how to heal, what you're doing wrong, what you're doing right. But ultimately, you're responsible for healing yourself. You can't suppress it. Every time you take whatever it is, maybe you have mucus coming out of your nose, you take an antihistamine. Eventually that suppression will go to the liver, go to the kidneys, and eventually it'll go to the bone marrow. And once that garbage, those toxins get into the bone marrow is where you make your red blood cells, where you make your white blood cells, where you make your platelets. So we don't want to suppress anything. We want honesty in our body. So you have to understand it's a healing journey. And that healing journey is the hero's journey. We have to go through the 12 houses of the zodiac, connecting to the 12 meridians, through the 12 cranial nerves, to the 12 branches of the solar system, as above, so below. And so our goal is to master the elements of the fire, the metabolism, the water, the emotions, The neurology is communication. I know Josh can kind of tell us a little bit about his healing journey, how he's been with me, how many years now?
Say it's probably 5 or 6.
5 or 6 years. And, you know, I've seen him when he was at its worst, and he'll go through a good period. All of a sudden, he'll hit a biofilm bomb where all of a sudden, you know, the parasites are coming out, and he goes into, you know, a healing storm. And he rides the storm out, and then he gets better. But every year you get healthier and healthier. Every year your bones get stronger and stronger. Your mind gets clearer. So aging is not a disease. Pregnancy is not a disease. Health is a way of life. And my goal is to turn you on to natural healing. And it is the greatest journey ever. And like I said, I opened it up with, to me, the greatest thing is our body's ability to heal itself. That to me is truly amazing. So again, thanks for coming, everyone. Hope you enjoyed my wife's delicious food.